Good morning. I think Sangeeta set a fabulous context, so let me pull you right into work. And that's what we're going to be doing for the next 2 days. In 2003 or 4, Apollo was building almost 6 hospitals at the same time, and we were tackling all this new frontiers and everything. And all of a sudden, our chairman, Dr. Reddy, changed track. I heard him at an international conference, and he was talking about India's triple gold medal, which I'm sure many of you have heard. And he started talking about it in 2003, 2004, saying that India will be will be the diabetes capital of the world, will be the heart disease capital of the world, will be the cancer capital of the world. And all of a sudden, he didn't lose interest in hospitals, but all of a sudden he realized there's more. There's more that needed to be done. And now we have to turn actually into wellness and pull these tools together. And then 2006, the PHFI was started, and Dr. Srinath Reddy took that, and then the government, and soon we started hearing the groundswell or talking about this new thing of NCDs. And I think that's one of the most important things that will be discussed in the next 2 days, not because I'm setting the context, but just because of the burden. It is huge. We're looking at something that all of you in this profession or associated with healthcare, you're going to be dealing with 75% of your burden is going to be because of NCDs. And you know, I don't have to preach to this choir about it, but you're talking about heart disease, you're talking about diabetes, you're talking about cancer, you're talking about strokes, so many of these, to the extent that 2008, WHO comes out with a report, and it says that this kind of a burden by 2015, India alone is going to be spending something like $15 billion on this. And if things were not bad enough, our knowledge partners, Bain, gave me some figures that talks about if we don't do things, by 2030, we're going to be spending $6.1 trillion. I mean, I couldn't say it in crores and rupees because the figures are just too large. So then we make it easier in the conversion and say dollars. 6.1 trillion. Today our GDP is 2 trillion. Can we afford this? We cannot. We cannot. And that's the context of today's first session of why it becomes so important. And if all of you are not convinced, or if I have to drive this point home further, let me tell you that even today, we lose a Canada, an entire country dies because of NCDs. And for those who are sitting at home, we lose a Mumbai and a Delhi. The world loses that every year to NCDs. And the problem being that large, you know, the actual thing is that it doesn't need to be. There are countries that have actually reversed that have been able to do, you know, that have been able to pull this together. And you know, I didn't believe it when I was looking at these figures. So I looked at our pharmacy, which is really the bad news barometer, and I looked at it and we realized 60% of what we sell in pharmacies are for these NCDs, for their cure. And then we said, what is it we need to do more? And that's the time, you know, today we're at 2014, this fantastic collaborative is together. So in this mission, this huge program, which is #1 on today's agenda, this Healthcare Alliance is charged with a mission. And this mission is we need to find solutions. And we love these acronyms, so let's call it CAN. And CAN, very simply, is the Coalition Against NCDs. So how can we make this happen? And it's not like we're just doing this today. You know, this is not the start. I can give you so many examples. We started Billion Hearts Beating, an NGO. And what do? We work with the National Cadet Corps. They have 1.3 million kids. So if we can teach them how to bring heart health better to their families, and then you get this multiplier effect. I know Dr. Lal told me, he sent me an email, FICCI, they surveyed 2 districts with this thing, and they saw what is the prevalence of NCDs. 2 months ago, I worked with the Mumbai Municipal Corporation and CII. In one day alone, we, on the World Diabetes Day, we tested 1 lakh people. The results, everything that comes up shows that it's scary, that we all have to work together. But that's the interesting thing, that this particular NCD story goes beyond this room. We do need people from the industry, people from the government, public health organizations, consumers, the FMCG industry. The world at large needs to be part of this, and it can be done. We can make this happen. And to lead us through this morning, I have great pleasure in saying that apart from this room, that you will be asked to participate, but right here on the stage, we'll have our knowledge partners. Karan Singh will lead that from Bain & Company. But we have people who have made this their life's mission, like Dr. Srinath Reddy. We have people like John Brooks from the Jocelyn Clinic, who's probably written everything there is to know and more about diabetes, and Dr. Mohan from India, who's pioneered so many cutting-edge ideas and taken it to a great scale. From the pharmaceutical industry, Sailesh Iyengar will participate. But you know, this would be isolated if we didn't have the strongest base which comes from the government, that needs to participate, that needs to lead this initiative. Dr. Srinath Reddy, he just jumped at this. So not only is he a conference co-chair, but he said, I want to do this. You know, he particularly said, PHFI's mission is NCDs. I'm going to deliver the keynote speech. So I thought I really need to put that out there. And then my favorite, Dr. Saida Hamid, who is going to talk, from the Planning Commission, who's really going to give this thing depth, because it has to go beyond. It's not going to happen in a year or two. So having said that, I think that the expectations are going to be huge. And this is the thing, that once we put these things together, once we get into it, this first session really needs to show how we can take this collective vision and make it, this is not a start. We're already in that. We're already down that road. But what we need to do is to create this infrastructure. This is an infrastructure building session. This is an infrastructure building conference. And I can only say that in this particular one, I think that we will win this battle. And so we are going to beat NCDs with NCDs. Excuse me for this another acronym, but it's so simple to remember. NCD, N would stand for a national policy level, and C would stand for the consumer level, and D, the development level. So so without much ado, may I request the panelists to come up, and I'm so looking forward to this session. Good morning to all of you.